have a septum in the middle of my uterus, and they've never told me through the IVF, through everything, and it basically will prevent me from carrying a baby like full term or be able to keep any pregnancy.
How do you find this condition? Through what?
I did a full body scan about 6 months ago, the Prenuvo, and with all the things I've done, like with the IVF and trying to freeze my eggs and embryos and stuff like that, no one's ever told me.
Do they say how you were able to get pregnant with Austin then and carry?
It was basically like almost a miracle.
I'm Dr. Lucky Seacon, a double board certified OBGYN and REI, and I want to talk all about uterine septums. In this podcast clip, Mary, one of the characters from reality TV show Sellingsunset, talks about how she discovered that she has something called a uterine septum. Now, this is surprising because she's had numerous scans as part of the egg freezing process and then later doing IVF in an effort to overcome infertility. Before we talk about how this could have been missed and why it's important, let's talk about what a uterine septum is. A uterine septum is one of the most common congenital anomalies that can affect the uterus, and it is not that common overall in the general population. About 0.5% to 2% of women overall will have a uterine septum, but 15% of women with recurrent pregnancy loss are found to have a uterine septum. When we're a fetus in our mother's womb, the way our uterus forms is essentially from two ducts that come up and fuse together. And then there's a resorption phase of the wall that forms between the two ducts fusing. And when that resorption phase is for some reason interrupted, you end up with this remnant called a uterine septum. And the issue with a septum is that it's taking up space in the uterine cavity. It's fibrous tissue. It doesn't have good blood supply. And therefore it's presenting extra surface area where an embryo may implant and then not have adequate blood supply. And this can lead to problems like first trimester miscarriages. Having a septum can also put you at higher risk of problems like preterm labor, breech presentation of the fetus at time of delivery, and problems with the placenta causing growth issues. However, it's important to remember that many people with a septum can go on to have healthy full-term deliveries because there is still plenty of surface area on the side walls of the uterus where there isn't a septum that an embryo could implant successfully. Now, you may be wondering, how could this go unnoticed after someone's had so many standard pelvic ultrasounds while going through a process like egg freezing or IVF? Well, it's kind of easy to imagine when you think about the fact that a standard ultrasound, you're getting a side view of the uterus where you're looking at the lining of the uterine cavity. And if you're not looking very carefully and sweeping through, you just kind of see this view and it's not going to be apparent that there is a wall dividing the two cavities. The uterus is a collapsed cavity, and unless you fill it with fluid and expand the walls away from each other, sometimes things like a septum can be hidden, especially with this view. If you do a 3D ultrasound with a regular pelvic sonogram, then it can become a lot more clear because you're getting this head-on view, and this is what a normal uterine cavity looks like. This is called arcuate, where there's a slight indentation, but here you clearly can see a septum, where you have this triangular-shaped indentation dividing the cavity in half. In general, 3D ultrasound is not used routinely when you're doing regular monitoring visits, but typically at that first baseline scan, if I'm sweeping through with that side profile view and I see something suspicious that looks like it could be a septum, I will do a 3D ultrasound to try to get a head-on view. Doing a saline sonogram where you instill saline solution into the uterine cavity to push the walls apart and get a 3D view is really the best way to understand if someone has a septum or not. But you can also look on HSG to look at the inner contour of the uterine cavity, and this shows you very clearly a septum. The downside of an HSG, which is basically just showing you a silhouette based on the X-ray view of the pelvic cavity, is that you can't see the outer contour, and so you can't really tell a septum from a bicornuate uterus where you actually have two different uterine horns. In cases where we can't get very clear definitive views on ultrasound, which can sometimes happen, we'll send patients for a pelvic MRI where you can get a very clear view of the inner cavity and the outer contour of the muscle part of the uterus. And that's going to give you a definitive sense of whether this is in fact a uterine septum, how big the septum is it muscular, is it fibrous, and this can help with surgical planning. The good news is that if you're diagnosed with this, it's actually not a major surgery to correct it, and it can be corrected, unlike some other types of uterine anomalies. We can do something called hysteroscopy, where with a long, thin camera, we can, under direct visualization, remove the septum just by kind of buzzing or cutting here, and it restores normal uterine cavity. In general, septums are not that common, and in experienced hands on ultrasound, they can be fairly obvious, especially if there is a 3D ultrasound that is performed. Anyone going through fertility treatment, especially if they're trying to get pregnant, should have a uterine cavity evaluation that should be able to pick this up, whether you're talking a saline sonogram or an HSG, which can look at your uterine cavity and your tubes. Of course, there can be some tricky cases, like a very broad-based subtle septum or a septum that is asymmetrical and kind of pushed to one side. These things can happen, but usually with repeat imaging and making sure you have very clear views, these things can be picked up. And the most important message here is that they can be rectified and there is hope for the future.